Hey, if you're turning 65 or if you're already on Medicare, this video is for you. In today's video, we're gonna talk about original Medicare, the parts, how it works, and why you need it. So let's get right into it. When it comes to original Medicare, the key components are Medicare's Part A and B. And as you're watching here, I urge you to maybe pause, get out a piece of paper and start writing things down. As we get into this, Medicare Part A, that's also going to be known as your inpatient hospital coverage. So if you're ever admitted into a hospital, you have to stay overnight, that's where Part A is going to kick in. And Part A is traditionally zero premium. You're not going to pay anything for it as long as you worked 10 years or 40 quarters or had a spouse work 10 years or 40 quarters. When it comes to Part B, that's also going to be known as your doctor or inpatient coverage. So think your family doctor, or when you go get a checkup, or maybe you have just a quick family doctor visit, that's where Part B is going to fall under, and that is going to come with a monthly premium. Most people are going to pay $202.90. You could pay less if you're a low income earner, or you could pay more if you're a high income earner, and we can help you decide what that number is going to be during your one-on-one consultation. Now let's break it down even further. How do you enroll into original Medicare? Well, there's really three scenarios, and what I always urge you to do is identify which one that you fall into. So scenario one, that's gonna be the easiest. If you're turning 65 and you're already receiving Social Security benefits, well, you're automatically gonna be enrolled, and we'll go a little deeper into that. Scenario two, you're not receiving Social Security benefits. This one's just a little bit different. And scenario three, this one's often the toughest. If you're still working and you're on employer coverage, well, we're gonna put those two side by side, and I'll go a little more in depth on that one. So let's focus here on scenario one. Like I said, this is probably the easiest scenario, and this is going to be if you're currently receiving Social Security benefits. And if you're currently receiving Social Security benefits, you're going to be automatically enrolled into Medicare when you turn 65. And you're gonna receive an ID card, your red, white, and blue card, also known as your Medicare card, about 3 months before your birthday. And again, that $202.90, that's your Part B premium. In this scenario, it's gonna be taken automatically out of your Social Security check each and every month, so you don't have to worry about it. Scenario two, this one's a little more difficult. This one requires manual enrollment if you're not drawing Social Security benefits. So again, scenario two, if you're currently not receiving Social Security benefits and you want to enroll into Medicare, well, you have to do that manually. And how can you do this? Well, you can do this online, over the phone, in person, or by mailing an application to your nearest Social Security office. In my recommendation, it's the easiest to enroll online, and we actually have a short tutorial that we can send to you. And during that short tutorial, it'll walk you through the exact steps to enroll online. Over the phone, that can be easy as well. Sometimes there's holding times there. In person, this is the one I would not recommend. It's gonna be hard to get there in person, and mailing, it just takes a little bit longer. So these first two options are probably gonna be the easiest for you. And if you decide, hey, I'm not gonna take Social Security benefits, but I wanna enroll in Medicare, you're gonna get billed quarterly. So $202.90 times 3, $608.70. You're gonna receive a quarterly bill, and you're gonna be responsible for paying that Part B premium until you start drawing your Social Security benefits. And again, last one here, scenario three, if you're still working and you're on an employer plan. Well, this is one of the most important decisions you have to make. And we're gonna take your employer coverage, we're gonna put it over here. We're gonna take that Medicare coverage, we're gonna put it over here. We're gonna put them side by side, and we're gonna say, which one is best for you? We're gonna look at price, we're gonna look at coverage. We're gonna look at all the different factors that are important to you personally and make a recommendation. So you can stay on your employer plan, you can enroll into Medicare if you want, you can delay Part B, you have a couple different options, and this is where we really come in and help you decide which one is best for you. So those are your three enrollment scenarios. As we work our way through here, there is one little intricacy if your birthday falls on the first day of the month. So for example, my birthday is in August. If my birthday was August 1st, my Medicare would actually begin the month before, so July, if your birthday's on the first day of the month. Weird little rule there. Always like to make sure you're aware of that. Now, just one thing that people don't understand is original Medicare does not cover everything. And a lot of people think, hey, I've got A and B, I'm good. That's not true. There are major exposures when it comes to original Medicare that you need to be aware of. When it comes to Part A, again, that hospital inpatient coverage, there's gonna be a deductible of $1,736 for each hospital stay. If you have a long hospital stay, it could turn into a daily copay. Now, when it comes to Part B, you have a deductible of $283. Everybody says, Chase, that's no big deal at all. I would agree with you, but here's the big one. You have a coinsurance of 20% with no limit. So think about that. If I have a $100,000 bill, Part B wise, I'm gonna be responsible for $20,000. If it's a Part B, I'm gonna be responsible, you can fix that, right? Okay. So Part B, when it comes to Part B, there's a deductible of $283. Everybody says, hey Chase, that's no big deal, and I would agree with you. But the thing you need to be aware of here is the coinsurance. You're gonna pay a 20% coinsurance with no limit. Okay, so if I have a $100,000 Part B bill, you're gonna be responsible for $20,000 of that. And again, there's no limit throughout the year on that coinsurance. So very important that you're aware of that exposure, and there's also excess charges that you need to be aware of as well. So there's no way that we would ever recommend you go with just original Medicare and nothing else. So when it comes to those major exposures, there's really two options that you have to cover those up. And there may be a third if you have an employer, but most people are only gonna have two options, and that's Medicare supplements and Medicare Advantage. So in this video, we're gonna quickly go over those and help you understand which one may be right for you. So original Medicare, again, that's Part A and B. We've gone over that plenty. You can add a Medicare supplement or a Part D prescription drug plan to that original Medicare and really cover up the majority of those exposures. Your second option would be a Medicare Advantage plan, and that is also known as Part C, and that combines your original Medicare and then adds an additional Part D plan in most situations. So if you're writing things down, again, I would draw a line down the middle of the paper, and on one side you're gonna have original Medicare with a supplement and Medicare Advantage with Part D coverage. Now, when we really break that down, here's what that looks like. If you're thinking Medicare supplement, that's gonna have your Part B premium, so you're still gonna have that $202.90. The coverage here, Medicare supplements, those are gonna have the lowest out-of-pocket expenses. So it's gonna be the most comprehensive, the most robust coverage that you can have when it comes to Medicare. Networks, you can basically see whoever you want as long as they take Medicare, and that's over 98% of doctors in the US. When it comes to Part D, you're gonna choose a prescription plan that best suits you. It's very individualized in this conversation. Now let's take a look at Medicare Advantage here. When it comes to Medicare Advantage, you still have that Part B premium. So no matter what, as you're watching this, we cannot get away from that Part B premium of $202.90. Coverage-wise, this is gonna be a lot like group coverage. You're gonna have higher out-of-pocket costs, you're gonna have co-pays, co-insurance. Networks, you gotta use specific doctors when you're choosing these plans, so there are restrictions on the doctors. The Part D, it's gonna be whatever comes to that plan. It's not very individualized, it's gonna be whatever comes to that plan, and then there's typically extra benefits that can entice people like vision, gym, over-the-counter benefits. So on this last screen here, I'm gonna put them side by side, and I'm really gonna summarize them here and hopefully make it simple for you. A Medicare supplement, that's gonna be the most comprehensive, most robust option. And if you're thinking, hey, I would rather just pay a little more to know that I have the best and most comprehensive coverage, Medicare supplement's probably gonna be for you. When it comes to Medicare Advantage, if you're okay with having co-insurance, deductibles, out-of-pockets, and some networks, well, Medicare Advantage may be that best plan for you. It's also gonna save you overall in your budget. So a little more expensive over here, a little bit less expensive, a little more coverage, a little less coverage, right? They're just kind of it's not a one-size-fits-all plan. And our job is really just to kind of look at these plans, look at your individual scenario, and help you understand what plan is best for you. Thank you so much for watching today's video. Hope you learned a lot about original Medicare, Medicare supplements, and Medicare Advantage plans. And I urge you, if you have questions, there's a one-on-one link below. Go ahead and click that, book that one-on-one, and we will answer your individual questions. You can also click the link to download our free copy of 64 Plus. That was a #1 bestseller featured on the NASDAQ billboard, which goes through Medicare 101 in book format, and you can take notes and highlight throughout the entire thing. And then lastly, go ahead and click the like or subscribe button and comment on what you learned below. We'll see you on the next one.